Good evening to our listeners and viewers, and welcome once again to this exciting session with Sawopa. Today's topic is on obesity, and my name is Dr. N. Putuka. And why obesity today? Well, for those who did not know, the 15th to the 19th of October is National Obesity Week. And the 16th of October was World Food Day, as well as World Restart a Heart Day. So I'm very happy to be talking about this topic. What is obesity? Obesity is a complex disease involving an excessive amount of body fat. Obesity is not just a cosmetic concern, but it is also a medical problem that increases the risk of other diseases and health problems, such as heart problems, such as diabetes, such as high blood pressure, and certain types of cancers. Well, there are many reasons why some people have difficulty losing weight. So before we can judge them, I think we need to really step back and think twice. Usually, obesity results from inherited physiological and environmental factors, and it is combined with what we put into our mouth, our diet, and the level of physical activity or exercise. The good news is that even modest weight loss can improve or prevent the health problems associated with obesity. A healthier diet, increased physical activity, and behavioral changes can help you lose weight. Prescription medications and weight loss procedures are additional options for treating obesity. How is obesity diagnosed? To diagnose obesity, your treating doctor will typically perform a physical examination and recommend some tests. These exams and tests generally include taking a health history. Your doctor will review your weight history, whether it has been fluctuating or has it remained the same for the past few months or years. Your doctor will also ask from you about your weight loss efforts. How active are you? And your exercise habits. Your doctor will also inquire about your eating patterns and your appetite control. And on top of that, your doctor will also ask what other conditions have you had. Your doctor will ask about your medication history, your stress levels, and other issues about your health. And most importantly, your doctor will also review your family's health history to see if you may be predisposed to certain conditions. Now, moving on to our second point, your treating practitioner will also do a general physical exam. This will include measuring your height, measuring your weight, checking vital signs such as your heart rate, your blood pressure and temperature, listening to your heart and your lungs, and examining your abdomen. Then we move on to calculating your body mass index. What is your body mass index? A body mass index is a simple index of weight for height. It's one of the most simple ways of screening for obesity. Your treating doctor will check your body mass index. A body mass index of 30 or higher is considered obesity. Numbers higher than 30 increase health risks even more. Your body mass index should ideally be checked at least once a year because it can help determine your overall health risks and what treatments may be appropriate. Adult body mass index is categorized into 4 groups. If your body mass index is less than 18.5, you are considered to be underweight. If your body mass index is from 18.5 to less than 25, you are considered to be of healthy weight range. If your body mass index is 25 to less than 30, you are considered to be overweight. And finally, if your body mass index is more than 30 or higher, you are considered to be obese. Depending on the actual level of body mass index, you may be considered to be grossly or morbidly obese. That is, if it's more than 40. Body mass index is the same for both sexes, male and female, and for all ages of adults. However, it should be considered just a rough guide because it may not correspond to the same degree of fatness in different individuals. Okay, the next test that is done is skin fold thickness tests. This helps measure the amount of body fat you have. Other newer ways of testing include 3D body scanner that can estimate your total body fat percentage based on your body shape. Another very important test for diagnosing obesity is measuring your waist circumference. Fat stored around the waist is sometimes referred to as visceral fat or abdominal fat. And this kind of fat may further increase the risk of heart disease and diabetes. Women with a waist measurement circumference of more than 89 centimeters and men with a waist circumference of more than 102 centimeters may have more health risks than do people with smaller waist measurements. However, like the BMI measurement, waist circumference is also not conclusive of diagnosing obesity, and it should also be measured or checked once every year. We also have screening tests that need to be done to exclude other medical conditions. These screening tests include your ultrasound, which can check for abnormalities in any of the organs in the body, your CAT scans, and your magnetic resonance imaging scans as well. And it is also important to do blood tests. These blood tests include your cholesterol levels to exclude cholesterol disorders, your glucose levels to exclude diabetes, your liver function test to exclude liver disorders, thyroid test as well to exclude thyroid diseases, because hypothyroidism is also associated with obesity. Heart tests also include electrocardiogram. Now, moving on to causes of obesity. Although we have genetic, behavioral, metabolic, and hormonal influences on body weight, obesity occurs when you take in more calories than you burn through your normal daily activities and exercise. Your body stores these excess calories as fat. Most people's diets are too high in calories, often from the fast food that we eat and high-calorie beverages. People with obesity might eat more calories before feeling full. People with obesity might feel hungry sooner than anyone who is not obese. And they may eat more due to stress or anxiety. Many people have jobs that are much less physically demanding, so they don't tend to burn as many calories at work. And even daily activities use fewer calories, considered as courtesy of convenience. You know, we have remote controls. We don't need to stand up from a couch to switch on the television or to change channels. You just click on your remote. We even have escalators in malls. We don't take stairs. We use lifts as well. And worst of all, nowadays, we use online shopping. You know, we can't be moving in the malls, you know, doing your shopping and filling your basket or your trolley. And oh my word, this one, we have drive-through shopping for food. McDonald's, KFC, Nando's, you name them all. Coming to risk factors, obesity usually results from a combination of causes and contributing factors. Family inheritance and influences. Sadly, the genes you inherit from your parents may affect the amount of body fat you store and where that fat is distributed. Genetics may also play a role in how efficiently your body converts food into energy, how your body regulates your appetite, and how your body burns calories during exercise. Obesity tends to run in families. That's not just because of the genes they share, but the other important factor is that family members also tend to share similar eating and activity habits. Lifestyle choices, an unhealthy diet that is high in calories, lacking in fruits and vegetables, full of fast foods and high-calorie beverages, and oversized portions contributes to weight gain. And I'm sure we will hear more about this from our nutrition and fitness expert in the coming days or so. People can also tend to drink many calories without feeling full, especially calories from alcohol or other high-calorie beverages such as your soft drinks can also contribute significantly to weight gain. Inactivity, if you have a sedentary lifestyle, you can easily take in more calories every day than you burn through exercise and routine daily activities. Looking at your computer, your tablet, phone screens is a sedentary activity. And I believe we can all attest to the fact that ever since we've had this world pandemic, lockdown has forced this upon us. The number of hours spent in front of the screen is highly associated with weight gain. So I'm sure we will hear from our expert on innovative ways of including exercise in our remote working. Certain diseases and medications are also a risk factor. In some people, obesity can be traced to a medical cause, such as the Prader-Willi syndrome, Cushing's syndrome, and other conditions. Medical problems such as arthritis also can lead to decreased activity, which may result in weight gain. Some medications can lead to weight gain if you don't compensate through a healthy diet or physical activity. These medications include some antidepressants, and I'm sure Sister Tilly can really attest to this. Anti-seizure medications, diabetes medications, antipsychotic medications, steroids, and beta blockers. Then we also have social and economic issues. Social and economic factors are linked to obesity. Avoiding obesity is difficult if you don't have safe areas to walk or exercise. Similarly, you may not have been taught healthy ways of cooking, or you may not have access to healthier foods. In addition, the people you spend time with may influence your weight. You're more likely to develop obesity if you have friends or relatives with obesity. That's sad, but it's true. Age, obesity can occur at any age, even in young children. But as you age, hormonal changes and a less active lifestyle increase your risk of obesity. In addition, the amount of muscle in your body tends to decrease with age. Generally, lower muscle mass leads to a decrease in metabolism. These changes also reduce calorie needs and can make it harder to keep off excess weight. If you do not consciously control what you eat and become more physically active as you age, you will likely gain weight. Other factors include pregnancy. We know that weight gain is very common in pregnancy. Some women lose the weight gain after giving birth, and others struggle to keep it off. Quitting smoking. Quitting smoking is often associated with weight gain, and for some, it can lead to enough weight gain to qualify as obesity. Often this happens as people use food to cope with smoking withdrawal. So it's important, if people quit smoking, to seek expert advice and opinion. Your doctor can help you prevent weight gain after quitting smoking. Lack of sleep, not getting enough sleep or getting too much sleep can cause changes in our hormones. You may also crave foods high in calorie and carbohydrate, which can contribute to weight gain if you don't sleep well. And these hormones actually increase your appetite, so you may end up eating more. Stress, many external factors that affect mood and well-being may contribute to obesity. People often seek more high-calorie food when experiencing stressful situations. We know people want to eat chocolate, people want to eat cake. Some may even want to have chips, So you actually have to watch what you're eating when you are stressed. And finally, amongst the risk factors, microbiome is our last point. Your gut bacteria are affected by what you eat and may contribute to weight gain or difficulty in losing weight. Even if you have one or more of these risk factors, it does not mean that you are destined to develop obesity. You can counteract most risk factors through diet, through physical activity and exercise, and behavior changes. Other risk factors include depression, disability. I'm sure most of us have seen My 600-Pound Life in one of the TV channels, whereby certain people cannot even get out of bed. Some, even their homes, need to be distracted for them to be taken out to seek medical advice or opinion. We also have shame and guilt, social isolation, and lower work achievement. So what are the most common health consequences of obesity? People with obesity are more likely to develop a number of potentially serious health problems, including cardiovascular diseases, mainly heart disease and strokes. Obesity makes you more likely to have high blood pressure and abnormal cholesterol levels, which are risk factors for heart disease and strokes. Type 2 diabetes. Obesity can affect the way the body uses insulin to control blood sugar levels. This raises the risk of insulin resistance and diabetes. Certain cancers. Obesity may increase the risk of cancer of endometrium, the breast, ovarian, prostate, liver, gallbladder, kidney, and colon. But these are not limited to these ones. It's just, I decided to just mention only these few for today. Obesity can also lead to digestive problems. It increases the likelihood of developing heartburn, gallbladder disease, and liver problems. Sleep apnea is also a complication of obesity. People with obesity are more likely to have sleep apnea, a potentially serious disorder in which breathing repeatedly stops and starts during sleep. We have muscular disorders as well, especially osteoarthritis. Obesity increases the stress placed on weight-bearing joints, in addition to promoting inflammation within the body. And these factors combined may lead to complications such as osteoarthritis. And now in 2021, we can add that severe COVID symptoms is also a complication of obesity. We have seen, science has proved that obesity increases the risk of developing severe symptoms if you have been infected with coronavirus disease. People who have severe cases of COVID-19 may require treatment in intensive care units or even mechanical assistance to breathe. The risk factors for these non-communicable diseases actually increase with an increase in BMI. Now, moving on to management. The aims of obesity management revolves around reduction of body weight. It revolves around maintenance of the lost body weight and prevention of recurrence or regaining of the lost weight, which a lot of people are struggling with. And it also involves maintenance of nutrition and preventing dietary deficiencies. This improves overall health and lowers the risk of developing complications related to obesity. And the thing is, for most people, losing a small amount of weight, even 1 kilogram, 1 to 3 kilograms, can have benefits. This may be sufficient to reduce the risk of developing diabetes or lowering the blood pressure. So people should not give up or lose hope when they are losing only about a kilogram or 0.5 kilogram per week. It's actually a healthy way of losing weight. Comprehensive lifestyle interventions, including nutrition, physical activity, and behavior therapy, are the foundation for clinical obesity management. Pharmacotherapy is indicated as an adjunct to behavioral counseling in patients who are grossly obese. These drugs that are sometimes prescribed for weight loss are not suitable for everyone and are not commonly used due to their risk of side effects. The treating doctor will prescribe the best medication for you based on the history that he or she has been provided with. And the medicines are usually recommended if the BMI is more than 30. We also have medical devices or bariatric surgery, which are considered appropriate for patients who do not respond to lifestyle counseling. These type of procedures, your medical devices don't require any incisions in the skin. After you're under anesthesia, flexible tubes and tools are inserted through the mouth and down the throat into the stomach. And common procedures include endoscopic sleeve, gastroplasty. They include intragastric balloon for weight loss, and they have been shown to work. Surgery includes your bariatric surgery, which is only indicated for patients with a BMI of more than 40, which is your morbidly obese individuals. There are several types of surgery that may help you lose weight, and these will control they involve reducing the size of your stomach and inducing early satiety and resulting in smaller meals and lower calorie intake. An operation, like I said, it is only indicated for severe or morbidly obese patients. Now, in conclusion, prevention of obesity is paramount. However, when obesity develops, various clinical treatment modalities should be available to improve weight and minimize comorbid conditions. Lifestyle interventions and counseling are the cornerstones of treatment. However, treatment actually involves a multidisciplinary team. And if lifestyle counseling does not work, patients will be put on prescribed drugs and referred for medical devices and or bariatric surgery.